Hi, good day. This is Silibet. So I'm going to demonstrate how to take the vital signs for today. So now I gather all the supplies needed. I have the BP machine here. I have the pulse oximeter, temperature. I have the gloves for contact precaution, client or patient, paper and pen for the documentation. So I did already the hand hygiene. I performed already the hand hygiene. So then the PPE if needed if the patient or the client is in contact precaution. So what we will be collected in taking the vital signs. We have the blood pressure, heart rate, respiration, temperature, pain rating, and an oxygen saturation. So I arrived already here in the client's room. So hi, I'm Yulibet. I will take your vital signs for today. Is that okay for you?
Yes.
Okay. Let me check. Okay. Take the armband. And your name, please?
Xavier.
And your last name?
Backay.
Okay. What is your date of birth, Xavier?
2010, May 12th.
Okay. Do you have any pain for today?
No.
Okay. So if there is no pain for the client or for the patient, it's easy if it is 0. So increase for the pain, it also increase for the blood pressure, heart rate, and the respiration rate. And also after for the surgery and trauma. If there is a patient saying that the pain is an 8 rate, so then we need to continue for asking of a question, where is the location, how is the pain, if it is burning or radiating, and then we need to document the numerical rating and how the patient described his pain. So next, I will do your oxygen status. So we have here the portable pulse oximeter over here. So we will turn it on. Okay. And place the device on the nail, bed, index, or middle finger of the client. So the tip, the finger must be warm with no nail polish, artificial nail, as this block the infrared light and result in inaccurate readings. So, okay. Okay, so your reading is 99. So the normal value for the pulse oximeter status reading is 95 to 100. So remove the device, clean and sanitize, and document. So now we're going to do the body temperature. So the body temperature is the internal body temperature of the human core temperature. So the normal for the adult is 36.5 to 37.5 degrees Celsius. For infant, it's a young children, 35.5 to 37.7 degrees Celsius. For the older adults, lower body temp is risk of hypothermic status, or the reasons are less subcutaneous tissue as insulation, less peripheral vasoconstriction capacity, decrease in muscular mass result in less heat production capacity. So temperature can be taken in oral, axillary, tympanic, rectal. So oral is to 35.8 to 37.3, axillary 34.8 36.3, tympanic 36.1 to 37.9, and rectal 36.8 to 38.2 degrees Celsius, and it will be inserted about 1 inch. So now remember that rectal and tympanic temperature is 1 degree higher than the oral. Axillary or temporal temperature is 1 degree lower than the oral. So let's take the patient temp on his axillary. Turn on the thermometer. Place in the patient axillary. And let's wait for the beep and read the reading of the temperature. Okay, so the reading is 34.1. Okay, turn off this one and document the reading for the temperature. Okay, for the next will be the pulse. Examining the pulse, also scale the pulse. So 0 pulse means an absent, 1 plus is weak, 2 plus is normal, 3 plus is bounding. So the rhythm will be either regular or regular. So in an adult, the most common site is the radial artery, which is an easy access. Use the index or the middle finger, but never the thumb one, because this thumb has its own pulse. Press lightly on the radial artery, wrist below the thumb. Okay, I got it. So count for a full 60 seconds if the rhythm is irregular, and a full minute is mandatory. If regular rhythm, count 30 seconds multiplied by 2. Okay, now let's take the pulse of the client. So my reading for the pulse rate is 85. The normal for the adult is 60 to 100 beats per minute. So now we need to stay in this position. Keep the finger in the position and count the respiration of the patient. If the patient knows that they will be reading for the respiration, they will be alter their breathing. So let's going to read the respiration of the client. Look from the side or watch the clothes or put the hand on the back while sitting. So when raising the clothes, let's count the respiration. Have the patient relax. So I count the respiration of the patient as 16. So the normal for the respiration rate is 12 to 20 beats per minute. So let the patient stay in the position. We will do the blood pressure for the patient. I have here the sphygmomanometer. The patient arm should be on the heart level. Okay. The feet flat on the floor. No leg crossing. Then relax. So the first sound will be the systolic, and the second that we will hear will be the diastolic. Roll the shirt of the client. Place the cuff 2.5 centimeter crease of the elbow with the artery marker aligned. Ask the client do not talk while taking the blood pressure, or do not look out on the machine that it will make them stress. The patient should not talk or look at on the screen. So we are using the automatic BP machines. So this one, we will see a numerical value. It's a 100 is the systolic, mmHg. Diastolic is the lower one, 63 mmHg. Okay, we will remove this one to the client. Okay, so now the normal blood pressure for the systolic is less than 120. For the diastolic is less than 80. So if it is an elevated blood pressure, Systolic is higher than 120 to 129. Diastolic is less than 80. So the hypertension stage 1, systolic is 130 to 139. Diastolic is 80 to 89. For the hypertension stage 2, systolic is greater than 140. Diastolic is greater than 90. Okay, thank you, Mr. Xavier. Thank you for your time. So all your vital signs are documented and I will be taking account in your record. Thank you very much. So this is where I wrap up all on how to take the vital sign. Thank you very much.